Now, when you analyze a complete blood count, you may see lymphocytosis. What normally we see is that lymphocyte count is between 20 to 40%, but you have to see this percentage is actually absolute increase in lymphocyte count, or it's because of the relative neutropenia. So we take the absolute lymphocyte count. The absolute lymphocyte count is between 1000 to 4800 per microliter. When there is absolute lymphocytosis, you see if the patient has a febrile illness, this may be an acute febrile illness or a chronic febrile illness. They can cause lymphocytes aggregation in the blood. So acute lymphocytic reaction can be seen in patients who got viral infections like CMV, Epstein-Barr virus, HIV, acute viral hepatitis, influenza. Some of the bacterial infections like pertussis or even cat scratch disease can cause lymphocytosis, and then you can have malignancies like acute lymphoblastic leukemias. They may be associated with lymphocytosis. Then there are chronic conditions like chronic viral infections. For example, chronic viral hepatitis like hepatitis B or C can be a reason for lymphocytosis. It's not a very common happening. And then you can have bacterial infections. Some other infections can cause lymphocytosis like tuberculosis, like syphilis or toxoplasmosis. They can cause lymphocytosis. And then autoimmune disorders like rheumatoid arthritis, SLE, or even hypothyroidism can be associated with lymphocytosis. Then you got malignancies, particularly lymphoma and chronic lymphocytic leukemia. In chronic lymphocytic leukemia, there is high lymphocyte count. In some of the lymphomas, there may be a peripheral lymphocytosis as well. In case of lymphomas, generally the malignant lymphocytes are within the organs, and sometimes they can spill into the blood as well. And then you've got certain miscellaneous conditions which can produce, for example, autoimmune disorders, as I mentioned, rheumatoid arthritis, SLE, hypothyroidism. They may be without febrile illness sometimes. And then you get stress. Both surgical stress or trauma can result in lymphocytosis. Then asplenia or drugs. If there is splenectomy or splenic infarctions causing hyposplenism, there can be lymphocytosis. Certain drugs, they can cause, for example, allopurinol, you got carbamazepine, vancomycin, sulfur drugs, and ibrutinib. They can cause lymphocytosis. Some of the drugs, they can cause atypical lymphocytosis. So you see, these are the multiple reasons when you can have lymphocytosis. So if you get a blood picture showing lymphocytosis, see if there is a febrile illness, it is acute febrile illness or chronic febrile illness, or there are certain other conditions which may be associated with lymphocytosis.